Hello everyone, my name is Dr. Aajay Shah. I work for Oaklawn Hospital in Marshall, Michigan. We are recording the short videos not just to educate patients in my practice but to the whole community and hopefully make the heart care and heart disease preventable. Today we're going to talk about atrial fibrillation. You probably have heard this term on TV many times recently because some of the newer drugs are available and it's on TV all the time. Atrial fibrillation is a simple condition where upper part of the heart called atrium starts fluttering, start becoming irregular and start contracting at 400 to 500 beats per minute. That leads to lower part of the heart, the ventricle, also contracting fast and start having we call palpitations or arrhythmia. The reason we worry about fibrillation is because fibrillation can cause clots in the heart. And if those clots can travel to brain, it can cause a stroke. So the major reason we worry about fibrillation because it can lead to a stroke. Fortunately, fibrillation is tolerable and fibrillation is easily manageable as long as we take care of it. So when you start having irregular heartbeats, if you start feeling palpitations, if you are checking your pulse, if your pulse feels irregular, make sure you reach out for help. You can always talk to your primary care. You can always call our office and we can see you. Sometimes fibrillation is diagnosed in an incidental way where you are having an EKG for an unrelated procedure or diagnosis and we find a fibrillation. Once you have fibrillation, the clock starts ticking in terms of prevention of the stroke. Once you have fibrillation, typically you would see me as a cardiologist and we will make sure you do not have any structural heart problem. That means you do not have anything wrong with your heart. Because if fibrillation is coming because there is a heart blockage, if there is a weakness of the heart muscle, if there is heart valve problem, then we need to take care of the underlying heart problem as we take care of fibrillation also. So if you come and see me for fibrillation, we typically will start with procedure called echocardiogram, which is an ultrasound of the heart. Ultrasound of the heart will look at heart muscle to make sure heart muscle is not weak. It will look at heart valves to make sure valves are not leaking or narrow. It will look at the covering of the heart. Ultrasound of the heart is a very simple, painless procedure, very cost effective and can be done same day if necessary. Other tests we may do for fibrillation is called a heart monitor, where we look at every beat you make every day, at least for 2 days, sometimes for longer, to see how much fibrillation you are spending your day with. So a heart monitor and echocardiogram are the two common tests. Sometimes we will do a stress test to make sure you do not have any blockage. Once we confirm that you have fibrillation, particularly you are in fibrillation for a long time, we start you typically on a blood thinner medicine. We used to use a medicine called Coumadin. You probably remember that medicine from your own experience or from some of your family or friends' experience. We used to call it rat poison. Very safe medicine, but it had its own side effect. It required a lot of blood draws on a regular basis. Fortunately now, for the last 3 to 4 years, we have newer medications which works as good and better than Coumadin and do not require blood draw. And they definitely prevent the stroke from clots going to the brain. So if you come and see me, typically I would put you on a newer blood thinner if you have fibrillation. Once you have fibrillation and once you are on blood thinner, we will have option of giving you a cardioversion or a little electrical jolt to get you into good rhythm. And many times after one jolt, you will stay in good rhythm. Once you are in good rhythm, many times we will stop the blood thinner. Sometimes we continue blood thinner for lifelong. And the decision to continue blood thinner lifelong will depend upon factors including having a high blood pressure, diabetes, heart failure, previous stroke. If any of those factors are present, sometimes we elect to continue blood thinner for life. Fibrillation is common, very common actually. After age 75, fibrillation is as common as 1 in 3. And after age 85, it's as common as 50%. So fibrillation is very common. Fortunately, fibrillation is very easily manageable. So if you feel you are having fibrillation, don't wait. See your primary care or come and see me. Other treatment for fibrillation we use also is called ablation, where we go through the groin, go up to the heart and burn a part of the heart with an electrical cautery to see if fibrillation can be totally abolished. That procedure we reserve for typically for young patients with a normal heart, but sometimes we offer that procedure to older patients also. So that we leave their option, something on the table, but typically we treat you with medications and blood thinners. Fibrillation, if it's managed properly, you can live with it for many, many decades, healthy life. So please do not ignore atrial fibrillation. Call our office if necessary. Thank you.